Hello, and thank you very much for joining me today. My name is Enrique Hernandez-Sanchez, and I will be speaking about thickening feeds as a first-line approach for infants with gastroesophageal reflux disease. Our learning objectives are to review the current NASPGHAN Pediatric Gastroesophageal Reflux Clinical Practice Guidelines that were published in 2018, to describe the non-pharmacological first-line approach in the management of symptomatic infants, and to review the thickening options available to date for both breast milk and formula. I am a pediatric gastroenterologist working for GastroHealth Pediatrics, and I did my training at Miami Children's Hospital for Pediatrics, as well as Mandel Children's Hospital for UCLA. I am the founding owner of Parapharma Tech, the makers of Gelmix Infant Thickener. Let's start with some definitions and some prevalence. Gastroesophageal reflux is just the passage of gastric contents into the esophagus with or without regurgitation and vomiting. This means that just the gastric contents are coming up into the esophagus and not necessarily causing any damage. When you have gastroesophageal reflux disease, it means that the actual tissue is already having damage and you have symptoms associated with this. The symptoms can vary from heartburn, chest pain, vomiting, feeding problems, or even extra intestinal manifestations such as respiratory issues. The prevalence of reflux disease in infants is quite high, and the study is quoted at 26%. But in premature babies, it can be up to almost half of those babies will deal with reflux disease. This is a copy of the graph that was published at the guidelines from 2018 from NASPGHAN and ESPGHAN, and I want to go over them slowly so we can break them down, each of these boxes. So the first box tells you that you are suspicious that a baby may have reflux disease, and you have to conduct a very careful history and physical exam. If you notice any alarm signs, then you should actually order the specific test and refer to that patient immediately. A good example of an alarm sign would be, for example, projectile vomiting or bilious vomiting, where you would actually have to send an upper GI series to document a normal anatomy and make sure this baby doesn't have pyloric stenosis or malrotation. If that is not the case, the most important first practice that we have to do is avoid overfeeding, thicken feedings, and continue breastfeeding. And I will talk about this more at length as we go on. If the baby is not better, then the recommendation is to consider a challenge with a hydrolyzed formula or an amino acid formula and see the baby response, thinking that maybe milk allergy is the cause of the regurgitations, the fussiness, or the vomiting. I will add my 5 cents here. I would probably tell you that as a pediatric gastroenterologist, before ordering a challenge with a formula that is very expensive and many times the baby doesn't like the flavor, especially those who don't have an allergy, I order a test called stool calprotectin, based on the fact that when you have allergic colitis, you will have a microscopic bleeding that will be detected through calprotectin. Calprotectin is a white cell protein that is located in inside, that is pretty strong, pretty tough, and it will resist hydrolysis by bile. It will resist hydrolysis by acid, by the pH, and the rough environment of the colon, and it can still be retrieved and quantified in the stool. When it is elevated, usually above 120, it will basically suggest that there is inflammation and activity, usually in the colon, and we can make a secondary assessment that milk allergy is the cause of this problem. If this doesn't help, then the referral to a pediatric gastroenterologist is recommended. And if you're not able to find one, then it is recommended for you to do a medication trial with an acid blocker for 1 to 2 months. I want to focus on the clinical practice that have to do with the first line approach. And those are simple practices, but there's still a lot of things that I believe that we can learn about this. About overfeeding, Everybody talks about avoid overfeeding, but it is sometimes difficult for parents to basically understand how much is normal to feed a baby. And I have a pearl that I learned when I was at UCLA that I was given, and I think that it works marvelously well to determine how much a baby should be eating. And this is the following. If you see my mouse here, you will see that I'm pointing to the top of the stomach, the fundus. And this basically is, if you were to fill the stomach all the way to the top, this would equal the weight in kilograms. So let me give you an example. If a baby is 4 kilograms, then if you fill the stomach all the way here, that would take 4 ounces. So weight in kilos equals maximum volume of the stomach. Now, for a baby who is dealing with reflux disease, you don't want to do that, because if you look carefully, the exit of the stomach is basically below the level of the fluid. And therefore, if you have a transient relaxation, you would definitely have then fluid pass into the esophagus. So for a baby with reflux disease, we would like to put this level below the sphincter exit, which is here. And this is basically 1 ounce less than the weight in kilos. So 4 kilos minus 1, 3. So 3 ounces will be the desired volume. For a baby who's healthy, we can push it a little higher, and we can do 3.5 ounces or half an ounce less than the weight in kilos. I also want to mention that reflux disease is caused by these transient relaxations of the lower sphincter that would lead for fluid to passively go up when the baby exerts any pressure on the abdomen, such as when the baby wiggles, cries, or coughs. The second step that we have to do is thicken feedings. And regarding thickening feedings, we will spend some time and we will go over some charts that will compare all the options available to do that. Another important recommendation on the guidelines was to make sure that we don't stop breastfeeding. Sometimes people will recommend to go to a pre-thickened formula instead of thickening breast milk. And I believe that you can safely and effectively thicken breast milk. Additionally, and this is a quote from the clinical guidelines, pump breast milk can be thickened with commercial thickeners such as carabine-based thickeners. Now, why is it that we do not want to have medications as a first line? And I think it's important for us to remember that there are certain side effects of medications. We have all heard about the fact that ranitidine was recently pulled out of the market when we have used it for almost like 40 or 50 years. And that was because in Canada, the equivalent of the FDA found that there was a chemical that was called NDMA that was being produced when ranitidine was being processed at high temperatures, and this is a carcinogen, and it was exceeding the maximum recommended amounts. So the Canadian government decided to pull this medication out of the market, and this had a ripple effect both in Europe and in America, and that's why for the last couple of years we're not able to prescribe ranitidine anymore. It's completely out of the market. After this happened, a lot of my friends, my pediatrician friends, called me and said, Enrique, what are we going to do? We don't feel comfortable prescribing proton pump inhibitors. What can we do? So we recommended for them to use famotidine, which is an alternative H2 blocker that can be used in infants. However, I have noticed that babies under the age of 3 months sometimes get very fussy with famotidine. And although the symptoms reflux will improve, they sometimes develop severe fussiness after starting the medication, and practitioners have to be aware that famotidine can sometimes make babies extremely cranky. Regarding the proton pump inhibitors, the main possible side effect with them are the possibility of increased risk of fractures. When we look at the data, if you use a PPI for more than 2 years, the risk of a bone fracture goes up from 1.7%, which is normal, to 2.3%, and it can be as high as 2.7% if you use high dose. This is believed to be related to the possible effect of the proton pump inhibitor on the osteoclast activity in the bone, leading to osteopenia. Finally, there is other less common side effects with proton pump inhibitors, such as an increased incidence of Clostridium difficile toxin, as well as aspiration pneumonia. If the medication is indicated, we want to keep the trial to a very short amount, usually 1 to 2 months. And usually after 2 months, I will try to get rid of the medication and see if we're successful, taking into consideration that reflux disease usually gets worse for the first 4.5 months, and then finally it will get better. Regarding thickening pumped breast milk, it is important to know that there is only one thickener in the market that can do that. And that will be a carabinum thickener, such as Gelmix. It is important to know not to use cereal. And many practitioners are still recommending families to add cereal to breast milk. However, this is not effective, since after a few minutes, the amylase in breast milk will digest the starch and therefore lose the thickening ability, and it will be the same as adding 2 or 3 teaspoons of sugar to breast milk. It will basically just be sweet, but it will not be thick. Finally, I'd like to make sure that you guys do not use xanthan gum-based thickeners on anybody under the age of 3 because of the risk of necrotizing enterocolitis. There's been a study done in California that studied the different gum effects on in the presence of acid in the stomach. And when they actually thickened breast milk with xanthan gum and they added acid, they found out that there was precipitation or clump formation. And they theorized that the presence of these clumps of precipitates could potentially result in a slower intestinal transit that may lead to severe ileus or small bowel obstruction and possibly necrotizing enterocolitis. Gelmix was used in this same study, and it did not exhibit this precipitation or clumping in the presence of acid. The ingredients for Gelmix are depicted on this picture. And if you look, it contains organic tapioca maltodextrin, as well as organic carabinum and calcium carbonate. And these are three simple organic ingredients that are combined to produce the effects that we mentioned. Our current recommendations say that we should not use it under the age of 6 pounds or a corrected age of 42 weeks postmenstrual. As far as the thickening options for both formula and breast milk, these are the current options that we have. And you have Gelmix, rice cereal, or infant oatmeal. If you are going to use rice cereal, the guidelines do mention that you want to use a low arsenic cereal, since rice cereal was recently detected to have a high amount of arsenic. Regarding the comparison between the three of them, the only one that can thicken breast milk, as we just talked about, is Gelmix. Infant rice cereal or oatmeal should not be used for this. They all are able to thicken formula, but Gelmix does not cause constipation. It will make you pass one more softer stools, as opposed to rice cereal, which frequently causes constipation, and oatmeal causes it in 20% of the cases. Regarding the added amount of calories and the amount needed, you need 1 teaspoon of Gelmix to thicken 6 ounces, but you do need more volume, which is 6 teaspoons for rice and oatmeal. This would lead to an increased amount of calories. For example, only 10 for Gelmix, but 30 calories for 6 ounces for both rice and oatmeal. And although some people may think that it's advantageous for babies who are underweight to then use cereal, I would caution against this, because when you are adding cereal, you're adding a greater amount of starch than you are of fat, protein, and minerals. So the way I explain this to my patients is, if you were to add more cereal to the formula, it's like adding more spaghetti to a spaghetti and meatball plate. Yes, you're going to get more calories, but it's all starch, as opposed to getting a more balanced meal with both starch, which is the spaghetti, and the meatballs, which is the protein and the fat. If you were to, for example, concentrate the formula to 24 calories and add Gelmix, you are able to get more nutrients and less starch for that baby. Finally, price is very important for our patients, and Gelmix costs 58 cents for every 6 ounces versus 40 cents for both rice and oatmeal. But I'd like to make you guys aware that our company has actually started a program already a few years ago to be able to provide a discount for those families in need. that brings the price down to 35 cents per serving. This program is called the We Care program, and it's a patient assistance program that is very easy to use. You only need to upload your Medicaid card as well as a referral from a pediatrician, a nurse practitioner, physician assistant, or speech pathologist, so we know that they're being supervised. And this will bring the cost down to 40% off, and the shipping is for free. These are the instructions on how to thicken Gelmix, and they're simple. We do have to warm up the liquid. Either water or formula has to be warm to around a shower water, which is around 100 degrees, and you need to add 1 scoop of Gelmix, which is 1.2 grams for every 3 to 4 ounces. After that, you need to shake or swirl in case of breast milk, and you let it thicken for around 5 minutes to get the effect. We always start with the lowest amount needed, and you increase as necessary. The only side effects present are the presence of gas or diarrhea that can occur in the first 1 to 2 weeks, but usually the gassiness goes away by either reducing the amount or waiting some time. Regarding the pre-mixing, I'd like to let you know, guys, that a lot of families pre-mix Gelmix for 24 hours by creating what is called a 24-hour batch of Gelmix water. And what it is, let's assume, for example, a baby will drink 30 ounces a day. You heat up that water on the stove. You add up the Gelmix that is needed. Let's assume it's basically around 1 scoop for 3 ounces. So you would add 10 scoops. You mix, you shake it or swirl. And once it's all dissolved, you basically add it up to the bottles. And you basically go 1, 2, 3, 4, 5, 6 bottles of 5 ounces. You cap them, and they can remain room temperature without spoiling for 24 hours. And this is quite convenient, for example, for the mother who's going out to the pediatrician or to the mall. The baby gets hungry. You have thickened Gelmix water. You just add up the powder for the formula, and then you shake, and it's ready. Obviously, this would not be able to be done with breast milk since it needs to be prepared immediately. In conclusion, it's important for clinicians to stay current on guidelines. The last guideline that was published was more than 15 years ago, so it's important to make sure that you review them to see what the new research is bringing to your practice. The second conclusion is that non-pharmacological approaches, such as thickening, are emphasized before trying medications. And finally, carabinum thickeners are the only choice for breast milk and may be preferred over formula. I thank you very much for your attention, and I'm open for any questions you may have.